My name is Shauna. I am one of the nurses here at Spotsylvania Regional Medical Center. Today, I want to talk to you about strokes. Let's start with what a stroke is. A stroke, sometimes called a brain attack, occurs when something blocks blood supply to part of the brain or when a blood vessel in the brain bursts. In either case, parts of the brain become damaged or die. A stroke can cause lasting brain damage, long-term disability, or even death. Here in the United States, every 40 seconds, someone has a stroke. Stroke is the 5th leading cause of death in men. For women, stroke is the 3rd leading cause of death. The good news is that 4 out of 5 strokes are preventable. Please speak to your physician about steps you can take to lower your risk of stroke. There are some factors that are not controllable, such as family history. Some of the risk factors that put someone at higher risk of stroke include having high blood pressure, high cholesterol, diabetes, and obesity. We encourage everyone to avoid smoking, or if you are a smoker, to speak to your physician about quitting. Getting your blood pressure and cholesterol checked regularly at least once a year. Controlling your blood sugar and maintaining a healthy weight are all steps that can help reduce your risk of stroke. A stroke is a serious medical condition that requires emergency care. Call 911 right away if you or someone you are with shows any signs of a stroke. Time lost is brain lost. Every minute counts. So you may be asking yourself, what are the signs of a stroke? Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or difficulty understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or a lack of coordination. Sudden severe headache with no known cause. If you are with someone who is having a stroke, we ask that you use the mnemonic Be Fast and do the following simple test. B, balance. Watch for sudden loss of balance. E, eyes. Check for any changes in vision. F stands for face. Ask the person to smile and see if one side of their smile is drooping. A is for arms. Ask them to raise their arms. Is there any drooping in one of the arms? S, speech. Ask the person to repeat a simple phrase. Is the speech slurred or strange? T, time. If you see any of these signs, call 911 right away. Note the time when any of these symptoms first appear. This information helps healthcare providers determine the best treatment for each person. Do not drive to the hospital or let someone else drive you. Call an ambulance so that medical personnel can begin life-saving treatment on the way to the emergency room. Thank you so much for joining us as we talk about stroke today. We here at Spotsylvania Regional Medical Center care like family.